Hello, hope you all are doing well today. This is my presentation on my research proposal for a place in the Master of Clinical Psychology program at the University of Townsville. Imagine Asha, a clinical psychologist who works in a busy clinic and has a client whom she knows desperately needs her long term help. Unfortunately, Medicare only funds 10 sessions. She tries to ask for more resources for her client, advocates for them, but her requests are denied due to government policies and a lack of funding. Late at night, she lies in a bed replaying her conversation with the client. I'm sorry, but this is our last session. She feels a knot in her stomach, a feeling of helplessness and guilt for not being able to help. This feeling is called as moral distress. Moral distress, first coined by Jameson in 1999, arises when one knows the right thing to do but is unable to do them due to institutional constraints. It is not about being incompetent, but about being structurally prevented from acting ethically. Institutional constraints, such as being understaffed, lack of funding, and extensive workload, can result in healthcare professionals developing moral distress. Research shows that such systemic barriers can negatively impact patient care, psychological well being of the staff, and job satisfaction. Research by Fumis and Epstein and Hamrick shows that moral distress among healthcare workers can lead to burnout. Additionally, if left unresolved, it can lead to employees leaving their jobs, further impacting patient care. Most importantly, such issues are systemic and can be resolved if organizational structures are reevaluated. So, what about psychologists? Research regarding moral distress has been largely focused on nursing and medicine related disciplines. It is also important to note that research has reported similar experiences among psychologists and social workers. Psychologists often deal with session caps due to insurance policies, long wait lists, extensive workload, clinician shortage, and a lack of funding. But the impact of these systemic barriers on psychologists and their well being has been largely understudied. Therefore, studying the impact of moral distress among psychologists is crucial. Doing so may help introduce reforms within organizations, improve supervision and support for psychologists, and impact broader healthcare policy making. The implications can benefit psychologists' workload, therefore, increasing the quality of mental health interventions and improving patient care. Addressing this, addressing this gap in the current study can help guide reforms and create a more sustainable environment for psychologists to connect with their client. Therefore, the aim of my study is to investigate how moral distress due to systemic and external constraints affects burnout and job satisfaction among psychologists. Based on prior findings, my hypothesis is that higher levels of systemic moral distress will be positively associated with burnout and negatively associated with job satisfaction among psychologists. To investigate this, I will conduct a quantitative cross sectional and correlational survey. I plan to recruit around 100 to 150 provisional and registered psychologists among specializations of clinical, counseling, education, and neuropsychology. They need to have 3 months of of client experience. Recruitment would occur through the University of Townsville's alumni network, placement programs, and the psychology department. To ensure rigor and compatibility with other research, I plan to use three psychological scales in the survey. First, moral distress scale is adapted to focus on moral distress due to systemic constraints on participants. Second, Maslach burnout inventory will be used to measuring burnout among participants. Third, satisfaction survey will be used to measure job satisfaction in organizational settings. And fourth, general demographics such as age, psychology specialization, hours worked, and caseload will also be recorded. The participants will complete an online Qualtrics survey that will take 20 minutes, with consent taken before the start of the survey, and they will be provided with psychological resources at the end of the survey. I will use a multiple regression analysis to examine the results of this survey. So, why am I the right person for this study? My motivation to choose this study comes from my personal experiences. Working as a behavioral support practitioner in schools, I've encountered situations where systemic barriers such as rigid school policies, lack of child development support, and limited resources have directly interfered with my ability to help my clients. There were times when even I felt a knot in my stomach, just like Asha. Moments where I wanted to give my clients the treatment they desperately needed and give them the access to the interventions that they deserved. But I could not due to systemic barriers in place. These reasons fueled my passion in learning more about moral distress and how it affects psychologists and what can be done to manage it. Additionally, I have a background in conducting research projects, having conducted two university student led research projects, engaged with decision making, conducted data analysis, and I have worked with psychologically validated scales. My experience in research has made me more reflective, analytical, and committed to ethical decision making, qualities that are essential for conducting research about practitioner well being. Therefore, I believe that I will be an ideal candidate for a place at the University of Townsville. To conclude, psychologists should not have to compromise their ethical values for their jobs. By studying the impact of systemic constraints on moral distress, we can find evidence that could support meaningful changes in organizational policy and structure. Thank you for listening to my presentation. These are the references that I've used.